So sorry for the interruption. So we are discussing about the splenic infarcts. So in fact, splenic infarcts happen because mostly because of the embolization, and the embolization happens from the heart. So the cardiac emboli, they will go into the splenic artery and they will get lodged in the branches of the splenic artery. They can cause single infarcts, and if they involve multiple branches, they can cause multiple infarcts also. We have discussed that spleen is at increased risk of embolization along with the brain and kidney. Why they are at increased risk of embolization? Because spleen doesn't have very good collateral blood supply. Okay, so spleen doesn't have very good collateral blood supply. So that is why they are at increased risk. And whenever there is splenomegaly, that will also increase the risk of that will also increase the risk of infarcts, because the blood supply doesn't increase proportionately. Okay, so though the size is increased, the blood supply does not increase proportionately. So that is why any cause of splenomegaly increases the risk of splenic infarcts. Okay. Most of the times, the splenic infarcts are bland infarcts. These are not due to infected emboli. Infected emboli, especially from the infective endocarditis of the left side of the heart. That means if it is involving the mitral valve or the aortic valve, because from the left side of the heart, the infective emboli can come into the systemic circulation and then to the spleen. So mitral valve and aortic valve infective endocarditis, they can cause suppurative infarcts. Okay, so in this condition, you will find pus also. But otherwise, most of the cases will produce bland infarcts. And if it is a recent infarct, it will be hemorrhagic. It will look hemorrhagic. And older infarcts, it will become pale. And of course, these are wedge-shaped infarcts. As you can see here, these are wedge-shaped infarcts. Okay, and you can also appreciate that they'll make this fibrin deposition over the capsule. Okay, so over the capsule, you will also find fibrin deposition. Okay, so most of the cases will produce bland infarcts, which will be pale and wedge-shaped. If they're recent, they look hemorrhagic, and there will be fibrin deposition over the capsule. Suppurative infarcts can be produced if the emboli is infected emboli from the infective endocarditis of left side of the heart. When these infarcts are healed, they'll form depressed scars. Okay, so when they're healed, they'll make depressed scars. Okay, so now coming to the last part. Okay, so now we'll discuss some other conditions. Okay. So neoplasms involving the spleen, especially the myeloid and lymphoid malignancies, they will usually involve the spleen. This we'll discuss in detail separately. Among the splenic neoplasms, you can also find the lymphangiomas and hemangiomas. Okay, little bit about this also we'll discuss when we'll discuss about the blood vessel tumors. Okay, of course there are many other malignancies which can metastasize to the spleen, so that can also produce secondary neoplasms, but these are the primary neoplasms involved in the spleen. Among the congenital anomalies, first we'll discuss about the asplenia. Asplenia means complete absence of the spleen, which is very rare condition. And if it is there, it is usually associated with situs inversus and cardiac defects. Situs inversus and cardiac defects. Situs inversus means the arrangement of the organs are, they are inverted. Okay, so in this condition, you can find the heart on the right side of the body. So the organization of the organs inside the body is inverted. Okay, that is known as situs inversus. Also, these are associated with cardiac defects. But complete absence of the spleen, that is asplenia, is rare compared to hyposplenia. So hyposplenia is much more common condition compared to asplenia. Next thing is accessory spleen. So this is actually a very interesting condition. Accessory spleen means you will find along with the spleen, you will find multiple small spleninculi. Okay, multiple small spleen-like organs. Those are known as spleninculi. Okay, these are present in 20 to 35% of the cases. 20 to 35% of the individuals you can find spleninculi. Now, what is the significance of this spleninculi or accessory spleens? Now, these are significant in patients. For example, in patients with hereditary spherocytosis, we have discussed that in patients with hereditary spherocytosis, if you do splenectomy, that is therapeutic for hereditary spherocytosis. However, if that patient is harboring these accessory spleens, okay, if the patient is harboring accessory spleens and it was not identified before doing splenectomy, even after splenectomy, the condition is not going to improve. Okay, the condition is not going to improve because these accessory spleens, they will still have functions of spleen. Okay, they will still be able to perform the extravascular hemolysis in patients with hereditary spherocytosis. So that is the functional significance of accessory spleens. Okay, so many times after doing splenectomy, when the patients with hereditary spherocytosis, they do not improve, we look for accessory spleens. Next condition is splenic rupture. The most common cause is blunt trauma to the abdomen, especially the left upper quadrant of the abdomen. Okay. Sometimes splenic rupture can happen because of minor trauma also. But minor trauma can only cause splenic rupture if it is associated with some of the conditions that increase the risk of rupture, like acutely infected patients, especially if the patient is infected with malaria. Okay, if the patient is infected with malaria or typhoid fever or infectious mononucleosis. In these conditions, the spleen is enlarged. Okay, the spleen is enlarged and it will have a tense capsule. So in these patients, even if they have a minor trauma, that can cause splenic rupture also. Okay. Now, what is the consequence of splenic rupture? Now, this splenic rupture, it's actually a life-threatening condition. Splenic rupture is actually life-threatening condition. Life-threatening because of massive intraperitoneal hemorrhage. It can cause, it can cause hemorrhagic shock and death in no time. Okay, so it's a life-threatening condition. And many times, if there is splenic rupture, the surgeons do splenectomy to salvage the patient. Okay, many times we cannot control the bleed from the splenic rupture and we have to do splenectomy for those patients. Okay, so these are about some of the pathologies of spleen. Of course, we will discuss the individual entities under different sections. Okay, so that's all about the spleen as of now.